Hi, my name is Maya Morris from Primary Care Development Corporation. The last year has had huge implications for primary care and thrown quite a wrinkle into quality improvement efforts. Quality improvement activities that were once considered routine were reduced, if not completely abandoned. And as we shifted focus to actually providing care during a pandemic, and of course, adopting a new method of care delivery, AKA telehealth. In honor of a full year of quarantine and the widespread rollout of the COVID-19 vaccination, now is really the moment for us to reinvigorate our quality improvement activities. So what does that mean? Well, we probably should go back to running some of the population management lists that we were running and looking at prior to the pandemic. So many of you were looking at the control of chronic or acute conditions, as well as preventive screening, such as various cancer screenings and vaccinations. I know that a lot of the children's vaccines we've been able to come up with, but maybe it would be a good idea to look and see which patients are due for Pneumovax. Additionally, a lot of you are looking at utilization measures. So patients seen in the ER, making sure we're following up with them, as well as other care coordination type measures like consults with the specialists, actually looking to see if patients are going to their specialty appointments and that you are getting the consult back and able to close the loop on those referrals. So that is a large piece of work, and I realize how daunting it can feel. The trick is, run those lists, take a look at how many patients are on them, and start calling 5 patients a day. And honestly, slow and steady wins the race. If you keep on calling 5 patients a day, you will see an impact. Make sure you have some sort of mechanism to run these lists and monitor the results on a regular basis. So whether it's quarterly, maybe you have a quarterly quality improvement meeting, or maybe more frequently at a monthly meeting. It's also important here to share the work, see if you can split up and run patients by care team rather than just by the full practice. And then we can involve everybody, whether it's the front desk and the MAs, they can get on the phone and call patients too. Additionally, since the pandemic, we actually have a whole new set of metrics to start looking at. So those are really our telehealth metrics. And the goal with this is to try and get an idea of what our engagement and retention has been for virtual care. So the main area to look at is really related to access with virtual care. So what is the volume of our virtual care visits and what is the type? So, how many of our virtual visits were via just telephone versus how many of those visits used video as well. Also, you can look at follow-up visits using a virtual platform versus new patient visits. Now, maybe you're not allowing any new patient visits virtually, but that sort of may be on a case-by-case basis at your practice. So it's really good to take a look at all of those access-related figures, because a lot of them do have an impact on your revenue that you're receiving, specifically whether or not the visit was using just the telephone or if it was using the video as well. Additionally, satisfaction is a huge piece with telehealth. So many of you may have incorporated just a few questions related to virtual visits in your regular sort of annual or biannual patient satisfaction survey. This is excellent. And if you have been doing it, kudos to you, keep up the good work. I would say keep those questions in, because hopefully virtual visits and telehealth will be around for a long time. At the same time, this is really the moment to come up with a long-term solution and strategy at your practice, because we really want, even as in-person visits are becoming more viable, we want to make sure we have a telehealth structure that really works for your staff and your providers as well. So I highly encourage you to download the tools that we have. We are providing a patient experience survey as well as a provider experience survey or a staff experience survey. And this is to help you create a long-term telehealth structure for your practice. It's a really good idea to just gauge where your providers are, what their major issues have been, and if there's anything you can mitigate to make telehealth feel more sustainable for them. The link should be right below this video. Please download it and let us know if you have any questions. Feel free to reach out. We would love to modify it to make it a little bit more specific to your practice. We are also providing a patient telehealth satisfaction survey. So this could be used as a standalone survey. You could provide it, you maybe send it along after a virtual visit. You could also send it regularly. You know, you could send it by mail, you could send it by email, and it really will give you a good idea of how your patients, what their experience was during that visit, and give you ideas to improve your virtual care. Thank you so much. Feel free to email me. I would love to hear from you. Again, my name is Maya Morse and my email is mmorse@pcdc.org.